Actually, there's 3 different ways to do hysterectomies. The most common way that used to be was a total abdominal hysterectomy, where we made an incision through the woman's lower abdomen, either in an up and down incision or across the low tummy incision, and we removed the uterus through the abdomen. And that's the most invasive procedure. It takes the longest time to recover from. Since then, we've, and it's been around quite some time, is a vaginal hysterectomy, where we remove the uterus through the vagina. There's no incisions on the abdomen or anywhere else except in the top of the vagina. And so instead of removing the uterus from the top down, going through the abdomen like we do when we do an abdominal hysterectomy, we actually work from the bottom up and remove the uterus that way. And we can even remove the tubes and ovaries through that way as well. Now, a woman has to be the proper candidate for that. Most of the time they have to have good mobility of the uterus, not having had previous surgeries on the uterus. So there's different ways that your physician would evaluate you to see what kind of candidate. That's actually the best way to do it. It has the quickest recovery time because there's no big incisions in the abdomen, and therefore you don't have stitches that have to heal from the outside. It's all done through the inside. The third way is laparoscopic hysterectomy, which we're doing many more of those as well. And that's done through laparoscopic incisions, which are small incisions about 1 centimeter in diameter in the abdomen below the belly button, and there can be up to 5 incisions to do that. There's 2 different ways to do a laparoscopic hysterectomy. One called straight laparoscopic hysterectomy, where the physician is standing over the patient and using instruments and removing the uterus, detaching the uterus from its structures on the inside, and then we remove the uterus through the vagina. The other way is using the robotic assisted laparoscopic hysterectomy, and that's where we put the same ports in, little trocars that we put instruments in, and then a robot is docked and hooked up to these instruments, and the physician sits at a console and actually operates away from the patient using a viewer that's 3D, and the robot actually mimics the motions that the surgeon's doing, and we remove the uterus, detach the uterus from its structures on the inside, and we remove the uterus through the vagina again. Those surgeries, the laparoscopic hysterectomy, have a quicker recovery time as well, again, because you don't have a big incision. The advantages of both a vaginal and laparoscopic hysterectomies are that it's a quicker healing time, quicker recovery time, less infection rate, and there's less risk to it than the abdominal. So we try in the order of to do a vaginal hysterectomy first if the patient's a good candidate. If they're not a good candidate for that, then we will resort to doing a laparoscopic hysterectomy if we can. If they're not a good candidate for that, if the uterus is too big or too much scar tissue or too many previous surgeries, then we'll do an abdominal hysterectomy.